everyone. I think we are live. Yes, we are live. All right. Hi, everybody. Hello, hello, hello. Happy Monday. Welcome to my little live. I hope everybody's week has started in the most fantastic way. And today is August 22nd, actually. And this is Rachel with the MPH Life LLC. Our life today will be a little different. I'm going to touch on the services of the MPH Life because I've been asked a few times, what exactly are your services about? So I'm going to talk about them a little bit today. Um, Otherwise, I hope everybody's having a fantastic day or, has started the week in the most fantastic way. Some of us have been really busy, as you can tell, but it's for the best, and we are really thankful. So it's all good. So the MPH Life was started out of an assessment of a deficit and a need in our healthcare system today. Not a need, really, needs in our healthcare system today. So the services of the MPH Life are tailored toward three particular areas, and it really can be two, but it's split in three for um, to give choices. Okay, the first one is health coaching, which is a big thing for us. Okay, after all, the MPH stands for maintenance. MPH stands for maintenance, prevention, and health. The prevention of illnesses, especially preventative illnesses, maintenance of health. So, health coaching, healthcare navigation, and advocacy. Okay. With that saying, the health coaching portion, this really focuses on the prevention of diseases, especially in the pre-stages, as well as the maintenance. And by maintenance, I mean keeping, if you were to be diagnosed, keeping those from progressing, getting worse, or even, you know, getting them under control, having them control um, to where, you are not, um, you don't feel controlled by the illness, to where the illness is not getting out of control. So one word can be also remission. So that would be like being diagnosed with blood pressure and getting to the point of not needing blood pressure medication. That doesn't necessarily mean that you don't have blood pressure anymore, because if you get right back to whatever you were doing and not paying attention to your health, you likely will get yourself back into the state of high blood pressure. Hopefully that makes sense, right? So there's the health coaching in that aspect, and also advocacy. That's for those that really wish to have a little more understanding of their state of health and be able to have a conversation with the doctors, have questions with the doctors, or even trying to understand why they are on this type of medication as opposed to that type of medications, and side effect of medications, and you know being able to ask questions, even in terms of family histories and things to watch for, concerns, that type of thing. So this is what we call health literacy, but breaking it down to you to where you can understand and have a good understanding of what is going on with you yourself, and so be an active participant in making decisions for your health. Um, Many of us trust our physicians, our providers, and that's very important. but oftentimes we find ourselves not being able to ask questions. First, there's often a time restrictions. Some are intimidated at times, okay? And some just don't know what questions to ask. And some of you will turn to Google with the questions, which is not the best thing to do because Google will freak you out and Google doesn't have answers specific to your situation. So Google may mislead you, especially if you don't have any knowledge base, any medical knowledge base. So that's you know the health coaching portion of what the MPH Life does. On top of it all, when it comes to to that coaching, there is the day to day because we don't believe in imposing, you know, as imposing things to you. You have to be willing to make changes. You have to be ready to make changes when you come to us. And now we look at your life, your current life, and we make changes, we make modification so that you don't feel suffocated, overwhelmed, or as if it's the end of the world because you got a diagnosis. But what changes do I make so that life continues, okay, while I'm actually controlling this condition? Now you will have to be responsible. But does that mean it is the end of the world? Does that mean it's the end of my life, quote unquote? Okay. So those are the things we do. That's health coaching. Next is the advocacy. So I touched about that again. That's the literacy. That's the giving you enough information and enough understanding of your own state of health, of what you really should know. You really should understand what's going on with your body. And that helps you advocate for yourself. The more you understand, the more you take better care of yourself too. You know, it's easy, they say ignorance is bliss. It's easy to ignore signs and warnings and symptoms when you don't know, when your body is trying to tell you, hey, this is going on, you really need to take some actions to prevent things. There are a lot of things that could be prevented if we were to pay attention to our body, if we were to make some changes to our lifestyles. So that's a portion of the advocacy. And then there's the healthcare navigation. That boils down to obtention of services. It boils down to choices of therapy, choices of treatment, choices of specialty, referrals, things like that. But this particular service really goes toward care management, and this is more specific to the senior population. So this service really appeals to the adults who are seeking help in caring for their senior parents. You know, when it comes to home safety, services in the home, navigating the multiple specialists, the medical languages or the medical language, all the medication. There's something called polypharmacy, so multiple medications that often get overwhelming for the patient and their families. The patient's state of health, you know, one concern that many have is the fact that the patient is seeing several specialists, and at times medication or treatment may conflict. And so you as the family member, as the son, the daughter, you have concern. You are not quite sure, you know, why this is happening and you are not quite sure what question to ask or how to stand for your mom or your dad. And so you need a medically trained professional to review, the plan of care, the medications, things of the sort, and to give you an insight, or at least to help you understand what all is going on. This is when also, when you are trying to figure out about the best care for mom, it's now time to talk about um, facilities, or can we still do this at home? If so, what services can we bring in the home? Is this possible? All of those things. You also want to start thinking about even uh, uh, um, legal dispositions to take. Basically, all that needs to be done to make things easier for you and also for your mom or your dad that you are taking care of. One, two, safer in terms of the medications they are taking, the treatment they are undergoing. Okay. One of my biggest nightmares is falls at home with the elderly, and oftentimes there are things you can do to try to prevent that if possible, especially when it comes to things in the home that should be taken out to prevent the fall. Sometimes it's medications. Sometimes there is a decline happening, there is a change that is not being picked up on. Even if your loved one has a private caregiver, sometimes they need educated on the changes they need to watch for so they can alert. They can alert you or alert the provider, hey, this is going on, so that an assessment can be done, right? So that's the healthcare navigation portion, that's the care management portion. So basically, the healthcare navigation has more to do with care management and it is geared towards the senior population. Now, somebody with multiple medical conditions could also benefit from this, because then things become difficult. Trying to obtain all sorts of medications, trying to access all sorts of services can become a little more complicated. So you are trying to figure out all the resources that are out there, all the services that are out there or in the community to navigate, your health challenges. So that's what the MPH is about. Now, when it comes to the senior population, the advocacy again it boils down to the medication review, but we are also the eyes and the ears of the family member. We can also be the link between the specialist for you, and check into, ensure, like, because we can check into records, we can obtain records, we can review records, so we can ensure that the plan of care are cohesive. And so if there is discrepancy, if there is conflict, we can jump in and communicate with the providers and bring issues to their attention for the sake of your loved one. If we see services that your loved one qualify, that will be beneficial for them, that is something we will submit to you first. If that's something that you find is appealing to you, then that's something we can bring up to the primary care or whichever specialist that needs to be submitting to the insurance or things like that. So it boils down to the safety and the best of our clients and your loved one. So in short, that's the services that the MPH Life provide. So ultimately, we are here to help you stay safe, stay healthy. You know, we are here to help you stay out of hospital. We are here um, to help prevent you from getting in the hospital or prevent fast progression of your conditions, you know, from lack of understanding or poor management at home. So if let me see if there is anybody that has a question. And if there is no questions, I will wish you guys a very good night. Make sure you post your questions, comments, send me a message if you do. Otherwise, I wish you an awesome night today, and I will see you soon. Bye.